Dr. Barbee received her PhD in social psychology with an emphasis in child and family studies in 1988 from the University of Georgia, and her MSSW in 2001 from the University of Louisville, where she did her practicum on the medically fragile team in child welfare. She is currently professor and distinguished university scholar at the University of Louisville Kent School of Social Work, Center for Family Resource Development. And Dr. Barbee has two major lines of research. One line focuses on child welfare system reform with an emphasis on the role of employee selection, training, supervision, and organizational structure, policy and dynamics have on practice and outcomes for children and families. And the other focuses on interpersonal relationship formation and maintenance, as well as the impact of relationship education on improving communication and conflict resolution. She's going to be presenting today overview of practice models, adaptive leadership, and implementation theories. And I can tell you, this is my own, that's not on the sheet. She is absolutely delightful and brings this topic to life. I could not have thought of a better after lunch speaker, and I'm not just fluffing her up, it's the truth. She has a sense of humor and a great passion for the work, and it's really a blessing to have her here. So without further ado, please help me welcome Dr. Barbee.
Thank you.
Welcome.
Thank you. I'm going to kind of roam because I don't do a very good job staying still. He was talking about all those mental health issues this morning, and I'm like, how many of those do I have? That I learned after my son got diagnosed. What I'm going to try to focus on are a few models of how to implement new programs in state agencies. And I'll weave in some information about adaptive leadership, and we'll also give a few examples from our own experience. And a lot of this talk is based on work that I've done with my colleagues at the University of Louisville, the Kent School of Social Work, and other collaborators across the nation. Actually, I gave a similar talk to grantees back in March. And so I had to shift around some of the slides a little bit for this audience, because I think most of you all are working in states as managers of what, adoption, foster care, in-home services. Is that where most of you work? Or administrative roles in states? So it's nice to talk to folks from the states because you play a critical role in making change in your agencies that can affect the welfare of children and their families and their foster families, adoptive families as they move through the system, as we learned this morning from Mr. Samuel's talk. So I'm going to use you as champions of this kind of work from your perspective in the states as I share kind of what we've done throughout the nation. Now, this is not as much focused on you all as it is the people who do demonstration projects for the Children's Bureau. But a lot of the work that happens from the Children's Bureau is knowledge building. So the demonstration grants that were just given out, the $28 million, are to empower folks in the states, private agencies, state agencies, universities, other folks who work in child welfare to help build knowledge of what works and what doesn't in the child welfare system. Because as you'll see, while there's a lot of evidence-based practice in micro kind of interventions with adults and children, coming out of psychology, psychiatry, other fields, and we've been adding to that as social workers over the last decade or so. There's less evidence-based practice of how to change a system or how to do that kind of work. And so, or systems that work in child welfare in particular, because a lot of our work is case management and case work that's a little different than therapeutic interventions. So we're going to shift the focus a little bit from this morning and talk a little bit about those kinds of ways that we can change practice at a more frontline level. And obviously it's important to keep building knowledge, and you all are partners in that we can't do good work and understand what works and what doesn't without the state folks who are overseeing the work or who are trying to implement change, supporting doing it in a way that will give us the best knowledge. And obviously, when we're trying to study the impact, you hear a lot about evaluation, and you have probably people in your state or the Children's Bureau, when you get projects, say, we've got to evaluate this, we've got to understand what works and what doesn't, and in this particular rollout of a program, we've got to refine it. And a lot of our work in the past were a lot of descriptive studies, correlational perhaps, pilot studies, looking pre to post with an intervention. And partly what's happening at the Children's Bureau as well as other governmental agencies is they're pushing us into higher levels of scientific inquiry, and that we're looking more at case studies, quasi-experiments, actually randomizing people to different kinds of programs to see, regardless of their background and all the different variables that they bring with them, what works best in working with different populations, and then obviously systematically reviewing that. So you're part of that enterprise, not just the grantees that come to other meetings for the Children's Bureau, but you in the state help this happen. I can remember trying to do a study of, this was back in the 90s, when laptops were just kind of coming out, and we thought of sending out workers with laptops. This was before little tablets that people were using. And I said, can we randomly assign people to the condition of being, either getting a laptop or not, because there's too many variables that are going to impact whether that helps them get caught up on their work. And they wouldn't let us do it. They wanted to get, of course, who do y'all usually choose for pilot studies? The people who need it the most, right? The people who are so behind on their paperwork that you're just dying to find something to work out for them. So of course I had all these people who were so behind on their paperwork that it would take a miracle for them to catch up. So I couldn't do random assignment, even though that was how we could really find out if this worked or not. But because I have a psych background, I gathered all these other measures and found out that extroverts need to be in the office because then it makes them actually do the paperwork, because when they were out in the field, so much working with the clients that they never got to their paperwork. It made them worse. They were probably already behind. And then the introverts, who really didn't need to catch up on their paperwork, really loved the laptop because they could really, catch up immediately after a session with a client and catch up because it's more, focused and quiet and solitude, and which was kind of not the purpose of the whole experiment. But this was with a commissioner who had her doctorate. And, I couldn't get her to do the random assignment to condition. It wasn't like I was going to jeopardize anything. It was just laptops in the field. But there's so much pressure from the practice community to let's try it out. Let's get all of our clients into this trial that we don't often know what works because, we're just putting everybody in and we don't have any comparison. So part of the reason why it's important for you all to see the kind of research that can happen and to understand how to build knowledge in child welfare is that we need you all to say, yes, we will slow down enough to see what works. And we'll do, anytime we can, we'll do the best kind of science that we can. When you're trying to do a demonstration project or when you're trying to do a new program or introduce a new policy, or all the different things that you all are involved in on a daily basis. Probably every year you have 2 or 3 things or more that you're trying to implement in your agency to make change that'll hopefully make your outcomes better. And generally, if you really are planful, you plan it and you pilot it, and then you run it, and then you evaluate it. And certainly with grants, we have to do this. But you all do this all the time with those kinds of projects, I assume. And so the first thing I want to talk about is how do you implement those kind of new projects and programs and practices in your agency in a way that actually will lead to the outcomes you're looking for. And there's 2 models I want to talk about. Again, there is evidence of how to do this well, and so it's evidence-based in and of itself. I met Abe Wandersman, who's at the University of South Carolina. In 2005, he pulled together a workforce at the CDC. Now, this was, of course, prevention work for preventing violence, but the CDC was trying to understand how do we get the knowledge that we have to the field in a way that will actually lead to the outcomes we want, and how do we get people to do programs with fidelity, meaning, the way it was studied, which is really another hard thing because everybody wants to change things once it gets up there. And I'm going to use my notes for just a second because I want to show you the picture because it makes more sense. Okay, let me show you the picture. So what we came up with is this model. All right, down here you have people out, doing research on what works to make change or to do casework better. And then there's some translators out there. Some of them are at universities, some of them are in your agencies who kind of take the information that we know. Certainly the Children's Bureau plays this role a lot. The Information Gateway synthesizes information and posts information on the web, and translates the knowledge that we have. Training systems often do this because they want to know the cutting edge work and how to help people meet the needs of their clients better. So they're often synthesizing information and putting into the training materials. With the research that we have, how do we take it from that level and get it all the way to the front line, which is that top box, the implementation delivery system? And really what it takes is the middle box of having folks to help support the work in making change in that front line. So you can either help build capacity of the practitioners in terms of the innovation itself or in terms of general capacity. So let's say that you've decided to do family finding, and you get somebody to come in as a consultant to train you on family finding and all the techniques, and you buy all the software, and you change policies so that people in your agency have to go through a family finding process in order to meet the needs of the case if a child's in out-of-home care. You've brought in a specific person to build capacity of the managers and the frontline people on how to do this. But any kind of innovation like that takes more than just learning it. I mean, could we all learn this technique and nothing ever happen? Does it take more to make a change like that happen, to adopt something like family finding in your agency? What other variables does it take? What else matters when you're trying to, you can train them and then they go away, then what happens? What else needs to happen? It needs to be implemented. What else? What supports that implementation? So more training needs to happen beyond just the expert. You need other people to do it. Usually training only can go so far. What do you need? You need what? Mentoring, supervision, coaching. You need resources, because that has some expense to it, doesn't it? Policy has to support it. Yes, somebody's got to make sure people are actually doing it. Yeah. So assessing to make sure that it's happening and seeing the impact. So those are all organizational variables that matter. So you can bring the expert in who teaches you specifically how to do the innovation, but then they leave, and there you are, left with some information that you hope you can make a difference. But that's that general capacity piece. And the other role that I have with the Children's Bureau is I help evaluate the impact of Training and Technical Assistance Network on states and how well they meet the CFSR outcomes. And what we found in the work that we've done over the last 7 years or so is that the TA providers can come in and give you expertise and help build your knowledge base or bring or synthesize knowledge to help you. But you've got to do something for the TA to stick and for something to actually happen that's sustainable. And so sometimes our TA providers aren't just giving you the innovation, they're trying to help build your capacity to do that. And so that's some of what we'll be talking about. That there's more to capacity building than just about the intervention. There's those supports organizationally that go around it. We'll talk about that. So that then people will be able to practice. So the practitioners need support. But what's the other thing that you need at the top on the front line? What do people usually say when they're taught a new model or a new way of doing things? What do they often say? Let's say it comes out of Washington, that there's this new way to do things, and we take it to your state. What's the first thing people say? Huh? Oh, well, there's that. More about if you're going to adapt it and do it, it's something about your clients. Well, what they'll say are things like, well, in Oklahoma, our people are really different than those people in D.C. that created this. So we got to adapt this and change it to fit Oklahoma. I'm just pointing out because Oklahoma's sitting in front of me. To change it for Oklahoma, because we've got a unique group, blend of folks who have Native American backgrounds, Hispanic folks who've come up from Mexico. We've got all this different cultural blend and environment that we've got to do this in. You can't just plop something down in Oklahoma and it work. And so, of course, the researchers are going, oh my God, you're going to change it? But the practitioners insist on changing it. And so part of our role down here in the bottom part is to figure out what is critical in that intervention and what's not so critical that you can play with so that everybody's happy. We know exactly what makes the change in the behavior that you're looking for in a family or children or the adoptive family so they won't disrupt the adoption. But you also need some wiggle room, some things to make it your own and make it fit your state, your tribe, your group. So this interplay is very important. And let's see if I've said what I need to. I think I described it. All right. Implications, of course, we need more research on what works in different localities, and that's probably what the demonstration projects do. You notice they spread them out across the nation, different kinds of, state-administered states or county-administered states or states with lots of different minority groups. And, they're all usually all around the country so that we can get some sense of what works with different kinds of people. We need to be able to apply that. Now, another piece of that interactive systems framework that Abe Wandersman came up with is that in order to implement, you've got to go through a series of steps to make that happen to reach the outcomes you're looking for. And it sounds so simple. It's really kind of common sense. And it's like he, copyrighted it. It's like, okay, whatever. That's fine. But the steps will be logical to you, and that's the good thing because it is intuitive. But if people tend to skip steps, and if you think back as I talk about these to the last thing you tried to implement in your state, the last practice change or policy change or training or whatever you've done, and think if you went through all these steps really. We'll find that most of the time we do something that just doesn't work out. So first you got to identify what you need, and if you have the resources, like you were saying. A lot of times we introduce something and there are no resources. You want to identify the needs and the resources. Then you got to set the goals to meet it, right? This all sounds very basic. And then you want to find out, is there any kind of, now this is before you pick what you're going to do to change things. Now usually we come up with some harebrained idea out of a shower. We were singing in the shower and all of a sudden we think, why don't I try this? Well, that's really nice, but there's no evidence behind it. At least evidence informed, about whether that deals with human behavior or could have any impact whatsoever on changing people. It's nice to kind of have it, based on something. And so we need to go through processes more and more as we build evidence to try to find things that at least are based in what we know about how humans operate. So that then we can assess what it takes to fit that in to the agency and then see what capacities you need to implement it. Does it take more resources? Does it take more training? Does it take coaches? What is it going to take to get this thing going? And then developing the plan to develop those capacities in that context, and then evaluate it as you're rolling it out to see what's working, what doesn't, so you can tweak it, and then evaluate the outcomes, which usually takes a lot of time afterwards. You can't just know within a day that something's working. It takes years sometimes to find out if it worked. And then you got to kind of feed that information back so that the program improves over time. And then you got to sustain it. Now, again, that sounds like just logic of how you would do something, but each of these steps takes a lot of work. And what we often do is we don't identify the need. Well, we kind of have a vague need, and then we might set up a goal or two, and then we usually just do whatever we heard worked in some state. And then we say, we're going to do it, and some leader says, I want it done yesterday. And then we maybe have a little bit of a plan, and then we jump in and we don't evaluate as we're going along, and we certainly don't evaluate if it worked. And we certainly don't have any CQI process. And then when it doesn't work or things don't change, you think, well, I guess it's the problem with the program or the product or the idea that I had, not that we didn't go through all the steps necessary to embed the thing in the agency so that, you get it to work. So, and I say we all do this. This is human nature to not kind of be systematic. But when I show you some of the examples, you'll see how that systematic work. And many of you, again, maybe the last time you didn't do it, but maybe another time you did. Most of you also have times when you've gone through this and you see that it works better. And this is how it works. Now, certainly when you're going through those steps, getting to outcomes, what Abe's research is finding is that if you have certain tools to help support the work or the new idea or practice, and training, somebody mentioned, and TA or coaching follow-up, and build it into your assurance process so that you have accountability, then that supports even that process so that you reach your outcomes. And so this is a nice model that there's lots of articles in the literature. If you just look up Wandersman, it's not like there's a lot of those in the field. You can Google him and all his articles come up. And it gives you kind of that basic, he's applied it to substance, people developing substance abuse programs for youth, teen pregnancy prevention, lots of different interventions. And you'll see later that we've applied it to instituting a practice model in a state. Now, while this was in the zeitgeist, I guess, in the mid-2000s, while Abe Wandersman was working on this model, we had the folks down in Florida at the time, now they're at Chapel Hill, Fixing It All, who had a implementation research network, and they looked at 700 studies in human services, education, mental health, a little bit of work in child welfare. There wasn't as much at that time. And they wrote a big monograph and posted it on the web of the findings that they gleaned from looking at all those studies. And the studies were not what works, but how you embed a new practice into an organization. And from that review of the literature, they saw that implementation is fraught with difficulty from the beginning to the end. And that what we often do is we'll do paper implementation. We might change the policy, but then we don't actually train people on the policy. We'll just send a memo. The policy has changed. Supervisors are supposed to just read it at their little meeting. Our policy changed last week. We might change a form, or two. But getting down to performance, like did they actually, do the new procedure, and are they practicing in a way that fits what the intent of the policy was? And is it actually having an impact that's positive? We gripe about these policies, but if we would follow it through and actually test it, then maybe we could say, well, this one worked and this one didn't, and you'd at least have some data to suggest that we need fewer policies. But we tend to get stuck, in the earlier phases. The other thing is these contextual factors that we were talking about earlier, that we don't always engage all the stakeholders. People have to be ready to change. I mean, how many change efforts have y'all been through when everybody's like, another change? Somebody raise their hand. Every time you had a change effort in your state, and people were like, I am so tired of change. I can't believe you're making us do another thing. People have to be ready to change. Organizations have to be ready to change. It's not just a matter of let's just add a whole nother, new thing to what we're already doing. You need to be systematic about it, and that can derail an implementation process. He also, the Fixing It All, also found from the literature that there are these 5 pieces for implementing practices and drivers that support them. So again, you'll see some overlap between this work and Abe Wandersman's work. That you want to know what works for whom under what circumstances, which is based in some literature somewhere, some research that's been done, and you're trying to change the behavior usually of a frontline worker in an organization that needs to kind of support them, and that everybody needs to know about it, and you need feedback on how that's going in order for it to get ensconced. And usually we're looking at changes in behavior or organizational structures or cultures or relationships. That's usually where our work hits the road. So, and then they talk about that there's different phases of the implementation project. So early on, you're just trying to figure out what should I do. You're looking up online to see what are the newest things, what's the newest evidence. You're deciding to adopt it, you install it, and then you get it fully operational. Don't we sometimes roll things out? Did y'all do that in your states? You roll it out, you do it in a few counties or a few jurisdictions or a few regions or a few cities, and then you roll it out to the rest of the state. It's fully implemented. It's fully operational, and then what happens? What's the biggest thing that happens in child welfare that keeps us from ever building to reach the nirvana that we're all looking for? Funding, but leadership. I mean, every 2 years somebody is taking over this different. and you're moving along, and you're thinking, oh, this is going to be great, and then we'll build on it, and we'll do this next thing. And then the administration changes, and they have a whole different way of looking at things. And of course, you know, these people who come in think because they were in a family, they know about families. And so it's like, oh, really, we don't need any expertise for this because we've been in a family. We're so excited that you're here with your special insights. And so then the thing is thrown out as somebody else's initiative, which, oh my God, we can't build on somebody else's work because then that's a political nightmare because we haven't done our own unique thing to make a change. And so all this work we've done gets thrown out and we start over again. And we wonder why child welfare can't seem to, you know, finish all the work that we have all the ideas, we just need to be able to do them. Bob Kellman wrote a book called Unleashing Change that talks about this process and how you can kind of engage a system to get through all these steps. He now is at the Kennedy School, and I think he was at the Kennedy School as a professor up at Harvard. Then he went into the field to run the procurement office. That's who orders everything for Bill Clinton. And, you know, can you imagine what a bureaucracy that is? I mean, if you think that we're in a bureaucracy, I think the procurement office would probably be the biggest bureaucracy that would ever exist. And that people get really, you know, attached to the forms or the things you got to go through to get a pencil. You know, can you imagine who works in the procurement office? You know? And so he had to change that culture to get them to be customer-oriented and to try to streamline the process so it made it easier for the customer to order something. And maybe actually not have the elevated rate for the government, but you know, a regular rate or cheaper. And to have them change that whole culture of how you approach the people, how you know, the processes you go through, huge culture change. And the way he did it is, again, he argues that you've got to have that leader, you know, who champions the change, but then they immediately need to find all the people who were unhappy to begin with in the procurement office, who wish that they could be nice to their clients and not, you know, you didn't fill this out right. And get them to be your champions, the ones who are already unhappy, who think, oh, change will be good because I'm kind of unhappy, not the ones who are just pretty happily content in how they're doing the work. Those aren't the change agents. Because they're going to fight you. Those are the ones that often end up being the ones who are the resistors. But get those champions excited, then some other people kind of follow along because they'll realize, you know, the wind's looking okay. And then you might get some of the resistors, and some of them may need to just retire. And, of course, it's easy for me to say, but now I'm 51, and I'm thinking, I bet the young people have a little target on my back. So I better be really excited about change. I'm the professor that teaches with chalk on the blackboard. When we talk about blackboard in my class, it's an actual one. So I haven't been really good about that kind of change process, but I think it's going to start catching up with me soon if I don't revise myself, and that target's going to actually take me out. But, all right, so there's lots of resources out there how you do this. And what the NERN model says is you've got to have lots of things in place for a project to actually invest itself and embed itself in the organization to get the change you want. And, you know, we often don't talk about staff selection, you know, because we kind of get who we, you know, get. Because are people lining up to be child welfare workers? There is not a line going down the block, and it's just kind of a sad thing because they don't realize this is the most interesting work. It's a tough puzzle to solve. You know, you're trying to do a lot with hardly any resources. You're trying to, you know, somebody had an analogy of child welfare is you've got a tablecloth and a table that's bigger than the tablecloth, and you're always kind of moving the tablecloth. And then something else gets exposed that doesn't have enough coverage. And then you're moving it again. I mean, you know, it's a tough environment. But, boy, we need some people who are creative and, you know, like a challenge. And we don't have them lining up yet. Because we haven't recruited, you know, we haven't done enough of that special recruiting that we learned in those demonstration projects we did a few years back. But the who you've got as your staff matters. The kind of training you do does matter. Now, in our CFSR, we do kind of look at training in a simple way, and then consulting and coaching and reinforcing it, evaluating it, and having those supports. So let me just tell you a couple examples from my own experience. I tend to be more of a storyteller. I'm a researcher, but, you know, I'm really a storyteller. And one thing we did that kind of relates a lot to what Commissioner Samuel talked about this morning is how do we help our children in our system and other poor children, because it's mostly poor children, in our communities achieve success so that they can live independent, successful lives. And way back in 1990 in Kentucky, that's where the state I work in, I live there. And I'm from Georgia, but you know, my husband's from Minnesota. We had to live in between. And he thought it was Midwestern. Anybody from Kentucky here? Is there any of my Kentucky colleagues here? No? No? Oh, yeah, Kentucky, thank you. So in Kentucky, in 1990, they said that our, talk about consent decrees, they said that our whole education system was illegal because we weren't giving enough resources to the schools in Appalachia and urban, you know, core centers. And some schools got more money than others, and they had to even it out, and they had to make sure that we all, and we, before No Child Left Behind, had standards that schools were supposed to meet and the outcomes the children were supposed to meet in order for schools to be deemed appropriate. And so as we were looking at that as a state, people were like, and then as a part of that, they said, we're going to have family resource centers that'll be in the clusters where all those schools are kind of poor to give other help, because a lot of this is not what the teacher does, although now the national discourse is that teachers are the problem. That really a lot of it is the families are poor, the neighborhoods are underdeveloped, there's not enough work, and we don't have enough supports, again, for the families to help the children get the food they need and the focus on the work, etc. And that we need a place for these families to go to get their needs met so that the children have at least that covered so that they can learn. But what happened when there's about 6 leaders, and this was just in Louisville, Kentucky, this big city. And the 6 leaders were from child welfare, who also oversaw family support, child welfare, family support, which is TANF and all food stamps and everything. The health department, who worked with WIC and those kinds of, and the family visitation programs, the school system, the mental health system, and I think those are the major leaders, maybe somebody else. And they all met every Friday morning, and they're still meeting, and it's been 19 years. And what they did, but you think, well, are they crazy? No. They met and they said, how are we going to actually make this happen? Because so many of these schools are struggling. Even if we infuse resources, there's more to this than just educating the children and just having better teachers and improving the resources there. And when they began talking to each other, they began to realize that these families, whether they're child welfare families or welfare families or having behavioral issues in the school, that they're often the same people. And that there were some issues around working with this same group of families, and that most of our resources went to just a few families. And that was bringing the whole ship, down in terms of being able to meet their needs. And then they thought, they had a really clever idea that instead of just the 6 of them sitting in the room talking, that maybe they would, get out of their offices and talk to some people. And they brought in about 1,000 consumers of these different systems to a big hotel like this and did focus groups with them and said, what keeps you from having the family life that you want, being self-sufficient, helping your children do well in school, avoiding the child welfare process, or being able to parent in a healthy way. And the number one thing that came out of that whole discussion, some of it was quality of services, but mostly it was just getting to the services. And what came out of that, and there was some things going on in the zeitgeist at the time, that maybe we needed to integrate our services more. And so we developed the neighborhood place model, which has 8 neighborhood places around the city of Louisville in a catchment area of about 5,500 poor kids. So the east end of town is really kind of middle class and rich. And so that's a big catchment area because there are not that many poor kids, whereas in West Louisville, where we've concentrated our poverty, we've got like 4 neighborhood places in a very small geographic area. Because the whole issue was we were going to put all these services, these different providers, in the same location on a bus line and close enough so that it was easy, within 30 minutes, everybody could get to the neighborhood place to get all their service needs met. And they were able to do this They rolled it out slowly. So remember we were talking about, you have the idea. There was actually some research at that point that showed that integrated service delivery had some potential, although there weren't really good outcome studies, but there was a feeling that could be helpful. And they rolled it out actually from 1993 to about 2001. They rolled out till we had all 8. It didn't cost anything more for anybody. It was just everybody just, had to kind of co-locate. So like the school system had some extra buildings. And they just, would give them to the groups. I mean, there were some resources, but not in the way you would think. It was not like we had to go out and raise a lot of money to bring this together. And in this last fall, the Harvard John F. Kennedy Center Ash Institute, which gives out governmental innovation awards, looked at this model, because it's been around for 19 years, and said, this is really amazing, but you haven't synthesized it in a way that it can be replicated. So I spent about 6 months writing a manual of how they came up with Neighborhood Place and how they did it. And in that, I had to kind of think, what does it take to do one of these and to build that kind of a system? And the first thing that struck me as I looked at this whole model, and I watched it happen as it was rolled out, but just sitting back and reading all the documents and things, it was that leadership team that, seems funny that they met every Friday morning and that they still meet, because it was from the top in all those agencies that they came together, they came up with a solution, and then they joined in. There was actually staff at those focus groups too, not just clients. They then went to so you have to have leadership, and you have to have the buy-in from all the people that you're dealing with. And many of you know this because you're always trying to engage youth and other consumers of our work to keep us honest. And so that leadership and that consistency throughout, saying we are going to make this happen regardless of any barriers that come up. We've had 4 mayors and city and county merger of government and all these different changes, and yet this thing is still there. No other configuration like this remained that long, as I looked in the literature. They did a needs assessment, they developed the model, they installed it slowly. Now they didn't do enough evaluation from my perspective, because that's where money would have been needed. And they did a lot of ongoing evaluation of satisfaction, and they did find that people were satisfied with it, and that there were more services given to clients. So that kind of outcomes they did measure. And we just had a paper come out in Child and Youth Services Review last month that did find that in the child welfare part, because this is what y'all would care about, we've got half the teams in Neighborhood Places and half in this building called L&N, this big, tall, bureaucratic cubbyhole building. And the turnover, I actually compared them to another city because I didn't want to make the people mad. But the turnover rate in Neighborhood Place is negligible, and the turnover rate in the big part of the building or in another city that's similar is huge. And though we had those numbers, and then I had a qualitative piece, and I asked people, what's going on with your office? And what the Neighborhood Place people said over and over again was, I'm in the community, I know these people, I've known them before because I've seen them come in for other services, they're not strangers to me. This is important, especially in an urban setting. Rural people, y'all have already known this, but us urban people are slower. You got to put them in the neighborhoods to get them out there. I have less stress because I can actually find them, I can get them to the resources, they get the help that they need right down the hall. We don't have to send them all over town. We're able to move through the cases faster. All these great things happen as a result of just the co-location and working together as a team. So, that's just one, example that's kind of big. Now, here's the one that's really child welfare. So, again, the 90s were big for Kentucky. And at first we had the big, Cabinet for Health and Human Services, we call it the big house. And somebody, I think it was Governor Patton, had the brilliant idea to take out children and families and make it its own cabinet. Indiana's done that. Some other states have done that around the country. And I think it's a good model because we weren't fighting for the attention of the governor with Medicaid and all the health things and all those other kinds of problems that tend to suck the energy out of these kinds of discussions. And so our secretary of the cabinet, rather than we had a commissioner, but the secretary sat on the governor's cabinet. And so if there was a child welfare or a family support or a child support issue, those were all in adult protective services, that was all in this cabinet. If there was an issue there, she had a direct line to the governor and was able to make the state. Now this was also, I'm going to describe a time when the economy was strong. Clinton was in the White House. There was a nice little period of time, in American history, when we had a strong economy. Clinton was in the White House. Viola Miller was the head of our cabinet, and she had a doctorate, and so she'd come out of education, believed in these kind of things. And she was there 8 years. This was the first time we could let a governor be there for more than 4. And so our leader was there 8 years. Now, North Carolina, there's several states around the country who've had long-term child welfare leadership. And when you have it, good things happen, is what we've found from some of the work that we've done. So this is a context I have to tell you up front because it's not always like this. The federal laws were spurring change. We had TANF, ASPA, Chafee. And I'll just throw this in because y'all wanted to hear about adaptive leadership. What Viola Miller was, and then she went to Tennessee and did similar things, is that she was an adaptive leader. And there's this another theory about how you lead. And there's technical leaders and adaptive leaders. And technical leaders are people who understand the work. And that's important to have, technical skills, to deal with problems and issues that already exist or that have existed in the past. I mean, we all like people with experience. And again, I'm not going to say we don't want people with experience, otherwise all of us who are over 45 will be out of our jobs soon. So I'm a little more careful now than I used to be. So technical skills are important, but adaptive skills is another skill set of making sure you're not just being able to solve past problems, but future problems, and you'll be able to anticipate where the world's going and anticipate what problems might arise and how you can rise to those, and have enough innovative people around you to help you adapt to the changing environment, and scanning that environment constantly to make sure your hand is on the pulse of what's going on in the environment, because the world's changing fast. And child welfare hadn't kept up yet. I mean, some little pockets have, like our SACWIS was in 1996, and now our people can't, they have to dial in. They don't have those cute little screens that some states have. I mean, now we're behind the states that have it web-based and are able to go out with their tablets and they can get the work done a lot faster. So you've got to, again, resources are nice. What she was good at doing was doing that kind of scanning and that kind of innovation because she was that kind of a thinker. They have these mindsets that know what's valuable and then what you should change. She was very into having things be research-based, and I hear that this Brian Samuels, as I saw his talk, he's reading the literature all the time. That kind of leadership and mindset of what do we know and where's the field going, and having and basing things on evidence is very important. Scanning the environment, responding based on your experience. So the lifetime experience does help, and it helps you reach that, but you've got to then be knowing what the new problems are, models values, and takes losses, meaning you make the change happen. I do find a lot of leaders, especially in child welfare agencies, because we're always worried that the child dies and we're in the paper, that they're afraid, they're frozen in fear to change anything or to do anything different because they're just waiting for the press to come get them. And that's not an adaptive leader. And it's not going to get you. In fact, it may open you up to more of that because then people start getting mad that you're not doing anything, when the kid dies. So it's part of that. So anyway, she was that kind of a person, could thrive in challenging environments. Like one of the first things she did was we broke down the silos between child welfare, family support, and child support work, and adult protective services. And she had this mapping exercise, which had paper all around the room, and we would go through different processes around the room of, what does it take, who makes the decision, what piece of paper happens, and eventually, streamlined a lot of processes, reduced a lot of the policies, made everything better. This is when we were flush and we had time to think. And that really helped when the economy got worse in the middle of her term after 9/11. So how did she change this whole agency? And she did dramatically. Well, she worked on staff. She hired more people to lower the caseload because she could talk to the governor if she got him to actually give her money for more staff. She developed a program called the Public Child Welfare Certification Program, and that's with all the 11 schools of social work. They give the BSW, and they worked in concert with each other to have the same syllabi, 2 courses, and then the field practice in the field, in concert with the training folks. So everybody got the same class, and same input and same change. And what we did is they also picked the best social work students, so the people who had the social work background and the values of that, and they got that specialization in child welfare and had been in the field, and then they were guaranteed to work there, and they came in more prepared, both because they knew what they were getting into and they hadn't left yet. Some left, because they realized, why did I pick this? And which is fine. Better that, it's like, don't, divorce is before the marriage. Better you leave than, you get 3 years down the line, we've invested in you, and then you're gone. So that was kind of a selection process. And then she was heavily into training because she had that education background, and strengthened our university partnership, developed leadership training, a field specialist program where we did a lot of coaching and mentoring after training happened. We developed behavioral anchors that, what are the key tasks that everybody's got to do as a frontline worker in these different roles in the agency, and we use that measure to track people and show their improvement over time, so that we could hold people accountable for changing in practice. Later, that whole training system turned into credit for their masters. She reinstated the master's stipend program. So training was huge, and it was often the way that change started was with the training folks. And then she aligned evaluations with those behavioral anchors so that people had to not just just come into work and be there on time to be able to be evaluated highly. It was the behaviorally measured, and the supervisor had the tool to measure how they were doing on the key behaviors of the job and clients, and that was the way they were evaluated. And she was able to do that throughout the 8-year period. Our TWIST data, that's our SACWIS data, improved. We began to survey foster families. We began to use research to test things all the time, roll out new programs, and again, did a lot of supports for things. Increased the pay for workers, lowered caseloads, got COA accreditation, started a practice model. So our practice model started in '96. So we're talking about practice models a lot now, and we were able to pull that together really early on to unify the work and the approach to how to deal with families. So all that happened in the rain, because she systematically went through and made these kinds of changes and built these supports to make, it was really a culture change that she was trying to do, a learning organization. It was in that context that with this practice model that we had, we wanted to reinforce how to do the work with the supervisors, because we had found in other work that the supervisors were really key in supporting change and supporting the model. And there was a supervisory grant way back in 2000 to get people ready for the CFSRs. This was before the CFSRs. And so we wrote that in collaboration with the cabinet. And we were lucky because we'd been in that consortium and been working with all these processes and all these programs all along. And what had happened with our practice model is it was developed with Dana Christensen, who's a family marriage therapy professor in the School of Social Work, the only MFT program in the School of Social Work in the country. And he, in collaboration with the agency folks, developed this model based on some theory that I'll describe in a minute. But in our supervisors, he'd worked originally with supervisors to make the change in practice happen. And we changed SACWIS, we changed how we wrote case plans, we changed policies, everything. But in Viola Miller's quest to make sure the whole agency culture changed, she spent a lot of time with supervisors for a while just teaching them how to supervise generally and how to be kind of a learning organization folks, and kind of didn't focus on practice for a while. So at about this time, people were like, when do we get to actually talk about how do we look at practice and make sure this practice change is happening and that it's actually having an impact on our clients? I mean, that's kind of like where we live, and we really want to get back to it. We like learning about how to manage conflict, but we really want to get it back to practice. And at the time, Dana Christensen and one training person were the only people who knew how to train this. And they hadn't written it down. They didn't manualize it. And so we got this thing, and we're like, do you have a manual? We didn't know this when we wrote it. Do you have a manual? He's like, no. So our first goal was to go and visit the trainings and write everything down and manualize it and get it out of the hands of the expert so that other folks could learn how to do this. And teach it to the supervisors. Now, to talk about the outcome, so you have to understand this model a tiny bit in order to understand what we found happened. So solution-based casework was developed because, now remember this is the 90s, so y'all have all moved past this now. Y'all are all strengths-based, child-centered, family-oriented. You've already moved past some of this, but early on, casework tended to be adversarial. People tended to have a whole list of problems that the family had and send them to a million services. Does this sound like the old days? Because I know y'all have all moved past this. And we didn't focus on outcomes, and case plans were the same case plan for every client. They weren't unique. And, and it was an adversarial thing. And you had all these people with their hands in the case, and they all didn't work together with one case plan. There was no coordination around the problem or how to serve it. And, so you'd have a family. You have the case plan, the family support case plan, the drug cancer treatment plan, the frisky attendance plan, the impact service plan, the comp care plan, the first step treatment of the children with developmental disabilities plan. And the family's going, I don't know how to. And so partly what this model was developed to do is to have everybody work off the same plan in collaboration. It's a collaboration model. It's very systems of care. In partnership with families, and pulled some work from some theoretical work around family life and how you intervene with families, and focused on everyday situations of family life, and developed plans that focus both on the adults that need to change and how the family needs to change. And to be able to help the family really work on some of the basic things that they need to change. All right. And the three theories are these. Because in the other article that you've got in your packet, we were trying to just talk about how you implement a practice model, and then the reviewers were like, well, what is a practice model? So we defined it, and it's my own pet definition that I don't really like. So you can argue with me, but I'm up here now, so it's mine. It's my chance. A practice model should have a theoretical base and a theory of change, not just be philosophically based. Because you got to fall back on the theory. I know people say theory. That is so, you're such an esoteric professor. But theory can be practical, and it can tell you how to act in situations where you don't know, we haven't scoped out for you. And the first part of the theory is family development theory, which is in everyday life events of the family, as the family's going through their family life cycle, as the children are different ages, there's certain tasks that are difficult. And this is true of everybody. This normalizes parenting. So, for example, what's the big task of a 2-year-old? Potty training, independence, saying no, asserting themselves. You got these developmental trends. And so parents, oftentimes, if you look at abuse in particular, it's around saying no, being defiant, never obeying you, pottying in the wrong spot, So that a lot of the child abuse and even the neglect of not kind of helping them move along on these milestones. is because the family's in a certain place, given where the children are, or where the family configuration is, and that's often where the abuse and neglect resides, and that all families have a tough time with this. It's just that a lot of us went to school or have multiple people in the house helping raise the children, or have some coping mechanisms, or have read the books, and kind of can manage most of the time. And of course not get detected if we do screw up, because we're not poor with everybody listening to our business. Another issue. So if you kind of help people understand that abuse and neglect happens in the context of everyday life events in the life cycle of a family with these kind of configurations, and that you can give tip sheets on how to kind of handle most situations that our families work in, it kind of helps the workers see the family from a strengths perspective and understand that this is normal. We all have a hard time. Parenting is difficult. But it also, and it makes you more empathetic, because we all have that. But then it's not enough to and the solution focused part is good, because you know that some of the time the families do okay. They do meet them, give them the meals, or they get them to school, or they don't hit them when they're potty training or whatever. And that's the solution focused part. There was a movement with that in Michigan for a while, and that's fine, and that's an important part, because you want to build on strength and not just look at the problem. But the nice little piece that kind of elevates both those is that then you need to have the cycle of abuse. You got to hold people accountable for when they're not doing it right. What are the high-risk situations for abuse and neglect? What are the things that trigger a person, or the early buildups in their own minds that make them vulnerable, or the late buildups of stress? And what do they do that's harmful, and how do they then justify it? Does this look like a circle you've seen before in another context? What's it look like? The domestic violence cycle? Yeah, it's the sequence. So you have to hold people accountable for the abuse or the neglect that they did engage in, but if you help people actually understand, honest to God, what led to it, then that's what you're treating in your case plan, and that's what you're trying to prevent in prevention plans, and that's what you're kind of not, I'm going to 50 services because this family has all these problems. It's how do I, with an alcohol issue, get them to the babysitter so that when I drink, because isn't that what some of us do? Just kidding. If I think I'm going to do a bender, I take the kids to grandma's house. No, I'm just kidding. Right? See, we keep our kids safe. We're not the whole perfect parent thing. Right? So you're just taking it a different. So it's very clinical, very, very to each family, very strengths focused, very much a partnership with the family to figure out what was at the bottom of the problem, has lots of skills on helping the family identify those situations so they can escape it. Just a complicated set of practices. And so supervisors need to support that work. And so what we did is to reinforce this practice model that we already had in our system, that already was in the case planning process. We took supervisors and their teams together. That's another nice method if you want to change a system. If you just tell supervisors something, they may be able to dismiss you. And if you just tell workers, they certainly will dismiss you and the things the new workers learn. But they learn it together. They can't play that game of that's not how we do it here, right? And then the workers have the support they need. And so what we did is we brought the people together and taught them, first the supervisors, some of the skills, and then we brought their workers in and they were doing assessments of their assessment, case planning, and management skills throughout the training with their workers. And then we followed them. We did a lot of studies. You can read a lot of there's a bunch of studies. Basically with that major study for the Children's Bureau, what we did is we had a group of supervisors and a comparison group matched who didn't go through the training, and then we tracked them, their learning and the outcomes for the cases over time, over a year, to see what made a difference in outcomes, as well as other studies to test our practice model. We'd already done some work showing that when people did it with fidelity, that people did a better job of working with collaterals and helping them, be more compliant in their casework. So we knew that this model could work with very difficult cases, especially families who'd been in our system before, because it was a new way of doing business. And we'd also done some qualitative work finding out from families why this worked better. And so for this study, what we found was that in terms of supervisors transferring the knowledge, that being ready for the learning and having support from their managers, that's what you all are, managers, and, you know, seeing the learning as useful and then actually learning it led to transfer, which means they actually used the information when they were supervising their workers in the field. And that led to better assessment skills, case planning skills in their people's practice. This is all in your handouts, don't worry. And then we looked at their practice outcomes in those teams and compared the ones who did this and with a training reinforcement and those who were in the control or the comparison group, and found that there was half the number of recidivism cases in the group who gotten trained, supervisors and workers together, and reinforced in the group who didn't go through it. So you could actually cut that in half if you would actually, you know, teach it and people actually did it. Permanency we didn't find it within a year. It takes longer for permanency outcomes to show up. Y'all could have told me that when we were developing the study. Well-being, we only found a few things, like people saw the dentist more frequently, and you think, well, who cares about that? Well, my father was a dentist. And so I have to tell you that, and when I was in the field, the thing that struck me most was how many dental problems were in, and maybe this is Kentucky, we have the worst teeth in the country. Most tooth loss, thus the stereotype. So being so in touch with your folks and your foster parents and folks to make sure the child actually gets to the dentist, because dentists don't always take the insurance or whatever, it's actually a big thing. It means you're really attending. It was kind of an indicator of attending to well-being that was kind of interesting to us. And of course, having them make sure they were visiting their parents more. And then when we took all this and looked at a bunch of cases, like 4,000 of them, and looked at adherence to the practice model versus non-adherence, we found that all of the, in case reviews, we found that all the outcomes, the 23 measures in the CFSR, were met when people when they were actually adhering to the practice model. So if you can get people to actually do the work, and you monitor the work and make sure they're practicing that way, it will actually lead to outcomes of changes for families and children. Unfortunately, by the time we did this study, it was 2008, and only 30% of our people were adhering at that point, because Vi Miller left in 2003. In 2004, we had a new administration from a different party. They didn't quite know what they were doing. They were very sweet, though, and they tried, and by the end, they were actually doing some good things. That was for 4 years, and then, of course, that was over. And we have a current administration that's been under the worst economic times in our state, and they haven't been able to do a whole lot. So I've seen Kentucky, you know, be at the height, and then the economy changing and having just a real struggle doing things. But even through all that, we've improved on our CFSRs from the first to the second round. And the likelihood is, because a lot of these things are still in place despite the lack of ability to do a lot of change, we're maintaining things. We're maintaining, you know, holding on with a thread to the innovations that we started back in the 90s. Now, so what are the takeaway messages? Everybody wants to move to a different state that has all these things, right? I'm working a little bit in New Hampshire now, and they've got it there. So if you ever want to go to a state where everything's working well, just go to New Hampshire. But if you can't do that, the world's not perfect. There are things you, from your middle leadership position, can actually do. One is insist that when you're picking your practice models or when you're picking new innovative strategies, that you find out about the evidence behind them and insist on it. That there be as much as possible, that at least be informed by research. That you make sure that training is happening, but that it's more than that. That it's focused on the intersection of training and policy, that it's embedded in policy so everybody feels safe, that your information systems reflect practice, so that the function follows the form. It's very difficult to practice with a different form, so you have to spend that time. The organizational culture matters, and you're part of making the organizational culture what it is, because you're leaders where you are. And so if you're adaptive and you're seeing changes, or you're coming to these conferences and seeing new ways of doing things, you can be the one that can be the change agent who says, we need to do this, and here's the evidence for how it works, and here's some ways we can actually get it done, and we can do it, whoever we are. And that kind of enthusiasm, and then getting people around you who can kind of help buffer that and join you in it, and helping the whole place get ready for change, can actually help you make the changes you want. Build capacity. Right. And you want to sustain it and build products. And what's important also about these meetings that I hope we're having in your smaller sessions is you need to share with one another what you're learning. You need to, when the resource centers, who are the Children's Bureau, people who help build your capacity in innovation and in organizational capacity, when they call you and say, please share what you've learned in your state on a webinar or on a teleconference or at this kind of a meeting, please do it, because that's part of building the knowledge of child welfare, and that's part of sustaining what you're doing, because then, sometimes we've had things where we're doing something in Kentucky, we go tell another state, they do it, and then they call, somebody else will call and we say, we hear you're doing this in Kentucky, and they're like, well, we didn't know we did that. It's like, wow. So it can reinforce itself, and you can, because, the leadership changes, and they're like, well, I didn't know we did that. I can remember one time people said, I didn't know we had a practice model. It's like, oh my God. Because there had been leadership change, they just didn't understand everything that they had already. So it's important for you all to be the carriers and to share and to build that. And please be friendly to the evaluators and the researchers. And help us do the best work we can, because it's for you. It's kind of like in Jerry Maguire, help me help you. Help us help you, and let us do as many experiments as we can, or quasi-experiments, and measure as many things as possible. And I know it's hard, but I promise you, you'll learn more and you'll know more what works, and we can feed it back to the system and make changes than if you don't let us. Don't just try to fix your problems through a new program. Let us test the program first, and then you can fix all your problems once we know if it works. We need to build that in more into our practice in child welfare. As I said, disseminate. There's me. Did I leave any time for questions, or did I just talk the whole time because I'm an only child?
No, I am too. That's interesting.
All right, thank y'all.